Hey, everybody, we are live. This is Dr. Michael K from the Center for Functional Health, and I am so looking forward to this interview tonight. I have the lovely Tracy Piper, author of the Piper Protocol. Tracy, welcome, welcome, welcome. I had the opportunity to meet you at the Integrative Healthcare Symposium. Thank you very much for speaking with me. I had a great time. Love meeting you. We got along right away. You know, every once in a while, you come along in life, and there's that one person who just commands the room. You're right there. You got my attention. Love talking with you. Learned so much, and now you're here. So thank you
Yeah,
very much for coming. I appreciate it.
you're so welcome, Doc. It's a pleasure meeting you. And likewise, it's like when we have scalar energy, we talk about how someone can enter your force field, and then you feel a likeness of energies, and that's exactly what happened when we met.
So welcome, welcome.
Thank
Um,
you.
Unbeknownst to you, I didn't know you had a book. And then when I was looking, I saw that you had a book, and you didn't know that I purchased the book and read the book. Um, and again, and I said to you on the phone when we were chatting back and forth, really great job. I've read other books where they talked about detoxification, where they talked about cleansing, and I think it was done such with haphazard direction. And I think what you've done, and you're willing to meet people where they are, I thought was really super special. And I really enjoyed the way you wrote the book, and you were able to support it with a scientific thought process on why you're doing what we're doing. Because I've had a lot of people, I'm sure you've had clients as well, where they went on a cleanse and the negative effect happened. So we got a lot to cover tonight. I cannot wait to learn more what you're going to share. We already have a nice little quote here. This is from Becoming Unique Experience. Thank you for writing in. Tracy is a true light, and I will ditto that for sure. So
Oh,
definitely you are. So let's begin. Before we get how you got here, your background is large, right? I mean, you have a lot of information. So can you share
yes.
first, what is your background?
So it's such an interesting topic. I was always trying to find out what is my title because when people ask me what do I do, and I go, I end up coming up with internal fitness practitioner. And people ask me, what is an internal fitness practitioner? And I go, well, when we think about external health, we think about someone, exercising and a fitness coach. But my whole goal is about making sure our internal organs are fit. And so I grew up in the Caribbean in Tortola with my grandmother, and I learned all about herbs. And I grew up where we used charcoal to brush our teeth, and very humble beginnings. So I have learned to be grounded, not because I wanted to be grounded or knew anything about grounding, but walking outside on barefoot, walking by the beach, just hang out, not realizing that I was taking in extra electrons and so forth. So I did my formal training at the University of the Virgin Islands. I got my bachelor's of science in biology, the mind and physical therapy. And then I moved here and went to Boston University because we'd have the first year of med school at UVI. And then a friend of mine that I was living with, her fiance died of severe constipation.
Hmm.
And I was like, how is that possible? And so that changed my whole trajectory on wanting to be a doctor and how I can actually help people rather than wait till they're sick. And so I ended up dropping out of BU and decided to go into alternative medicine and decided to go and get my master's in Oriental Medicine. So I have a master's in acupuncture and Chinese herbology. But that was not all. I wanted to go deeper. And I realized when I started getting colonics after this happened to my friend, that I noticed that the acupuncture held more. The massages that I got held more. I felt clearer. There was clarity. It was as if I had dirty windshields in my eyes. And then after the colonic, it's like my eyes were totally clear. And I was just like, wow, this is amazing. And so I went to Canada to study colonics because Canada is a little bit more up on alternative medicine. But become a little bit of a nerd. One school wasn't enough. Two schools wasn't enough. Three schools wasn't enough. I ended up going to four different colon hydrotherapy schools so that I could learn different methods and learn different things so that I can be a master of what I do. I don't like to go into things haphazardly. And so I have to own what I do in order for me to want to work with people. So that's where I started out. I went to Canadian Health of Healing Center. I went to the Edgar Casey School it's in Virginia Beach. I learned so much there. And so I have a love for the colon, as everyone, all my clients know. That's all I talk about. But I also studied iridology, which is study of the eyes with Judy Vedder, and she studied under Bernard Jensen. So I study iridology and also under Lillian Bridges for face mapping. So when I'm doing a consult with my clients and we're doing something like this, I'm reading their face and figuring out where I need to work on before they even open their mouth. And I'm jotting down notes so that I can ask them certain questions. It also helps them have some security in me, because I'll say something to them that they didn't mention and they're like, how did you know that? So then they start to relax a little bit, like, okay, this person knows what they're talking about, but their face told me what was going on.
Which is excellent, because if you remember, we were having a conversation and you said to me, you said, hey, you really seem to worry a lot. And I said to you, well, if I didn't worry a lot, what do I do with all that free time, right? I mean, I'm like, okay, so let's start with there, because you were headed off to conventional, traditional medical school. I mean, this is what you were going to do. And now you went a different direction.
Yes.
And, we'll talk about colon therapy. We're going to talk about herbs. We're going to talk about acupuncture, internal fitness. But let me just start with, like, you say face mapping, you face reading, right? You don't, that's not like a normal statement to people. Like, well, what do you mean you're reading my face? Now, obviously I'm angry and, I'm bird, eyebrow and all that. And, then you can say, wow, that person is X, right? But
right.
You and I were just having a conversation and you said, hey, you worry a lot. I mean, for, full disclosure, I worry, right? So I am a worrier. I worry about things that aren't and things that could happen, right? So,
yeah.
My wife says I'm always waiting for the hammer to drop, and nobody even lifted the hammer, right?
Mm-hmm.
So I think that's very interesting. I really do.
Yes, and worrying. I mean, how you can see that on your face. We talk about, like, a lot of people will have like a line in the center of their eyebrows that goes straight down. And so that's kind of like when we like push our eyes together and we're like very intense. But when that line turns under the eyebrow, that means that irritation, that's something that's like, I want to get there, gets more intense, and it curves under the eyebrow. That's when we go into extensive worrying, extensive pensiveness, overthinking. And that taxes the spleen. And the spleen is the organ for transforming and transporting food in our body, but it's also the largest lymphatic organ. So you can see how that can just be taxed just by you thinking too much, how that can affect your digestive system. When our digestive system, when we're supposed to be like relaxed when we go to eat. But if we're like worried about what happened during the day when we go to have a meal, which most of us do, because we're at a dinner table, people tend to talk about what happened during the day, whether it's good or bad, or just, and you're having all that energy coming up, or like a fiery conversation at dinner, your digestive system just shuts down because you now went into sympathetic mode of fight or flight. Your body doesn't know that you're talking about something that happened at work. For all it knows, a bear is coming after you and it needs to protect you. So it doesn't have time to break your food down. It's going to shut that down and send all the blood to your extremities so you could run away. And so when that happens, like in your thinking all the time, everything just shuts down. You start to get bloated. You have no enzymes releasing. We have no hydrochloric acid releasing. The food sits there longer than it's supposed to. It starts to ferment. And when it starts to ferment, that starts to feed the bad bacteria in our system. One of them that's well known is Candida. And that stays there for a long time. You start to feel a little foggy, a little tired. And this goes on over and over and over for a long period of time until it gets to the point where it's like the kettle is about to blow the lid. And the body gives us warnings. And we kind of ignore the little warnings. It kind of like gives us a little tap on the hand. And we ignore it, or we get a headache and we ignore it until the body says, oh, wait, you're going to continue to do that? Okay, I'm going to make sure you listen now. And it hits us with something really hard that can knock us down, or a migraine or something that we must pay attention.
Right.
And that's when we go into certain things.
And we see that in the office. I had a patient the other night, a new patient, and like, well, how long have you been having these complaints of off and on diarrhea, constipation? And you're like, well, I guess since my teenage years. I'm like, well, you're 31 years old now, right? So it was just a norm, right? You go to the doctor, and she's got brain fog. She got dermatological issues, and it's all of this leaky gut kind of scenario, right? Pretty much what you just said, this
Yes.
intestinal permeability. So it's very interesting how it all ties together. And you talk about the spleen, and you did not know this, but there was one point in time where, you're about worry in the spleen, had the spleen ultrasound, and they're like, hey, it's a little bit larger than it should be. So you didn't even know that.
I didn't know that.
No, you didn't know that. So that, I find that absolutely fascinating. That's really incredible. And you use the words internal fitness. Now, most of us, when we talk about fitness, we talk about, hey, we're going to work out, we're going to, get fit, and we're going to feel strong.
Right.
But I want you to talk about this internal fitness, that this internal fitness needs to be as strong, if not stronger than the external fitness, right? So it's one thing to lift a heavy weight, but it's really better to move your bowels every day and to have this internal fitness.
Yes, and make sure. I was so married to internal fitness that when I was writing my book, I made sure they put it right there. I was like, I was only married to two things: the color of the book, which is the color for the colon area, and internal fitness, because it meant that much to me. That and one chapter on colonics, of course.
Right.
So internal fitness is your organs, and they have to work. We want we want to be here on this earth for as long as possible, and we don't want to be on this earth where we're in a wheelchair, or we're bedbound, or we're a burden to someone. We want to be enjoying our lives in our 70s, in our 80s, in our 90s, walking around. I just went to see my neighbor yesterday to take her some flowers because her dog died, a friend of my dog, and she's 93. She doesn't walk with a cane. We go to church together, and she's so vibrant. And it's so beautiful to see this 93-year-old woman, and we walk around and we talk, and it's beautiful. And that's what we want. We don't want to be in our beds, with getting bed sores. And so internal fitness is like making sure that our organs, our cells are clean, our bowels are moving, and the water that makes our blood comes from our colon. So if you're not going to the bathroom, I consider the colon the most important organ in the body, because if the water that makes your blood comes from the colon, and the colon is really dirty, and you're not going to the bathroom, you're going to have very dirty water, murky water. Your liver now, with everything that we breathe in, we put on our skin, we eat, everything passes through the liver as a filter, and another filter is the spleen as well. So now the liver has never been cleaned, because how many of us clean our oil tank per se? Because that's what, in the car, we go at 3,000 miles. You go and you make sure your oil is changed and you check. But we don't do that for ourselves. So the liver is running on the same dirty filters from the moment we're born until you get really, really sick. So now you have these dirty filters trying to clean this dirty, murky water. It's not going to really clean it properly. So now you're going to have semi-clean water making semi-clean blood that's feeding all your organs, all your cells, all your tissues. And the difference between myself, you, or someone else that might be listening is the toxins go to the area that is weakest for you. We all have our inherent weak part. Some people, it's the joints. You have arthritis. Some people, their weakness might be the brain. They might have Parkinson's or MS or something. Somebody else, it might be their kidneys. They have issues with diabetes. So the only difference is what area of you is have a less voltage, or what we call voltage, because healing is voltage. And if our cells are low in energy, then that's when those toxins go to that area. Because it's like, ooh, your defenses are down. Let me get in there and take control.
So let's jump right into it. Let's talk about colon therapy. Let's talk about colonics, because we hear a lot of negative things about colonics, right? So we hear positive things, but in the conventional medicine world, it's kind of like, don't do that. You can get dehydrated. Don't do that. You can get a perforation. Don't do that. You can get an infection. It's not really needed. Just take the Linzess instead. Take the over the counter fiber is all you really need. That'll clean you out, but it really doesn't do that. And that's why I loved your explanation in the book, because in the book you went another step and you talked about like, here's who shouldn't get colonics, right? Because when you look at a lot of this stuff online, you look up colonics, it's like everybody and their uncle should get it, and it will cure everything. And you never said that in your book. You never said it will cure everything. You never even talked about that. So let's start at the beginning. Who should not get a colonic? Who should not go to a colon therapist?
So if you have issues like your organs are failing, if you have recent surgery, so say you just had an abdominal surgery 6 weeks ago, you do not want to go and get a colonic. You're having congestive heart failure or kidney damage, you don't want to go and get a colonic. Those are fissures. If you have a fissure in this, that's a cut opening by the rectum, you can get infected there. It's also extremely painful. You don't want to get that. If you have advanced stage cancer where in the colon, where the walls of the colon is already thin and you're bleeding, you do not want to get a colonic. If you have ulcerative colitis, Crohn's, and there's bleeding, no colonics. So if someone is pregnant as well. Now, the thing with pregnant, because I do work on people that are pregnant, I always tell people the answer would be no. But if I've worked with them throughout their entire time before they gotten pregnant, I know their body very well. We stop the colonics for the first trimester because the baby needs to implant and stay there and have a nice home. After this first trimester is over, then you can do a gentle colonics. And colonics is done very differently during the pregnancy than you do when you're not pregnant. And I've done colonics with doctors working with their patients all the way up until 2-3 days before they give birth. So it all depends on what's going on with that person. And if you also can work, sometimes the doctors, like you said, will be like, no, but I also work with lots of GI doctors. I am blessed to have a few doctors that I'm speed dialing my phone, that if I have a question about anything, that I can reach out to them, that believe and understand about colonics and the importance of it and how it can help their health. So I'm very happy to have those people in my life that I can talk to and send for colonoscopies and so forth. I'm one of the doctors that wrote the forward in my book, Dr. Alejandro Younger. He was a doctor at We Care for many years, and I learned a lot from him over the years. My own doctor, Dr. Patrick Fratellone, amazing. He's an internist, a cardiologist, and an herbalist, functional medicine doctor. I mean, the man has every degree you could possibly think of. And so I have people that I can talk to about these things when I'm working with people that have, serious or different complex cases.
So let's talk about like when a patient comes to you, is it standard practice in your field that some type of pre-examination is done? Do you perform some kind of questionnaire? Is that typical? Is an individual like you, are you like licensed different in each state, country?
So each state have a different so colon therapy is not licensed, it's a certification, and each state has their different rules for colon hydrotherapy. There are colon therapists and there are colon technicians.
Okay.
Do you understand what I'm saying?
Right.
So for me, I have a vast education before on the body, the anatomy, the physiology of the body, way before I became a colon hydrotherapist. So I'm not just looking at the colon, I am looking at the entire body and how things come in. Like I said about the face, someone comes in for their skin, psoriasis or eczema, how is that tied into their colon? Hair thinning, how is that tied into? So the colon is the root of it. It's kind of think of like the trunk of a tree, and you have all these branches that's going out all over. but at the root of it is where you need to work on. So I look at the whole picture. My intake form is extensive. It's 6 pages long.
Ooh.
They're like, you need to ask me all these questions. And I'm like, yeah, by the time I make a joke, I said, by the time you finish that intake form, I'm going to be your best friend. I'm going to know everything about you as much as your mom. And they laugh. But I also have a way of asking the questions in my intake form, because if I'm asking you something direct and you don't really want to tell me, you're going to tell me what you think I want to hear.
Right.
And that doesn't help me to help you. And most people unconsciously, that's what they do. They tell you what you want to hear. So I have a way of working in my intake form to get the truth out of them, so I can truly help them properly. And then we talk about different things and so forth. Now, if someone calls me before and they want to do a consultation before a colonic, I will do something like this, and I'll do like a Zoom call or FaceTime, and I'll do the face mapping. I'll go over their blood work. So and see what's going on with their blood work. Are they in range? Are they out of range of certain things? What is in range? What is out of range? Is your liver enzymes high? Is your liver enzymes okay? If you're in a range of say 0 to 10 is the range, and you're at a 9 and 10 is like, I'm not gonna wait until you get to 11 to say, oh, let's deal with that. You're already at a 9. So why wait until you tip over? Let's deal with it. And they're like, well, I'm in range. My doctor said I'm okay. I'm like, but you're at the end. Let's not get there. Let's bring you back to the middle and deal with things right now. How can we change simple things in your life, in your lifestyle, that can help you move forward and become more internally fit? Like on my post, I put be internally fit, or I put internal fitness, because that's the whole goal. Is we all want to be around to run around with your kids or your grandkids or travel or do all these fun things. And the only way you can do that is if your health is intact. And that means you have to be internally fed.
Right. Right. So basically with your intake and the question you ask, and I can't help myself, but you'll know this person inside and out. So basically
Yes.
is what it is, right? Literally
Yep.
inside and out,
Inside
right?
and out. Yeah,
So
exactly.
somebody will say like, okay, well, wait, that's just, a colonic. This is just the same thing as a high-powered enema. Why can't I just take an enema? And, you explained in your book why that is, but if you can explain to everyone who's going to listen, why don't I just take a bunch of like Miralax and do a high-powered enema and I should be good to go.
My thing is, I always tell people when they ask me that question, I said, okay, if you take a bath, if you bathe your skin with baby wipes, is it as clean as taking a shower with soap and water?
Nice. No, it's not. That's great. That's good.
That's it.
That's
So
good.
you're doing herbs, you're doing things, and I'm an herbalist, so I'm all about herbs, but you're not going to get everything. You're going to move things up, but there's always a residue. Nothing cleans better than water. Now, you can have a situation where people can get overlogged, too much water in the system, not enough minerals, not enough electrolytes. You don't want that. That taxes the kidneys. So the colonic only goes for a certain amount of time so that you don't overburden the body. Everything is in balance with life. Even if you take too much vitamin C is great, but if you take too much vitamin C, it becomes a problem. So it's all about balance. So an enema can go up to the first third of the colon. You can turn your body and let the gravity bring the water all the way down to your right side, and you can massage it and so forth. But there's nothing more than getting water in and water out, going out and getting that gas out, and then the water goes higher, and then getting the gas out, and then the water goes higher and getting more gas out. So the water goes all the way over to your cecum area and then flush out. So much more than I would say a quart, maybe like a liter of water. Let's say a liter of water for an enema. So this is like my Mountain Valley water compared to like maybe 2 to 3 gallons of water in a colonic. Again, which one is going to clean more?
Right. Got it. So you talked about in your book, and we're going to circle back to this colonic, but you talked about involuntary bulimia. And I want you
When I
to
was a kid.
share if you're open to how this came about.
When I grew up, I was living in Tortola, and I didn't understand it because, of course, I was a child. But now that I'm in this field, I'm like, oh my goodness, My digestive system problems started since I was a child. Oh my goodness. So I was stressed out. I went to live with my grandmother from the time I was age 2.5. So not knowing her, never met her, I just was dropped off there and was like, what? Who's this old woman? And what am I doing here? And why is my mom leaving? Not knowing what that does to your to your system, to your parasympathetic system, your nervous system. So I wouldn't eat. My grandma had to force me to eat. And I figured out a way how to just put the food into a bag and so not eat the food. I had gotten so skinny you could count my ribs.
Hmm.
And so the teacher came to the house with the police um to say, "Hey, are you feeding her?" Like they thought my grandmother was starving me. My grandmother showed them all the food. She just won't eat. Every time she eats, the food just comes right back up. Now that I know that's the vagus nerve tone, but every time the food would go down, so I would have to, like, in order for me to keep the food down, I would have to drink a lot of water to basically force that food past my sphincter to get down into my system, which is the worst thing you want to do is to eat and drink at the same time.
Sure.
It got to the point that I was so skinny that they started giving me steroids to get me to eat something. So I went from bones to like I blew up. And then when I blew up, they were like, okay, she's fine. And then when the steroids wore off, I went back skinny and then they hit me again with more shots. So I kept going like this and it totally screwed up my system. And so I realized, like, why is it so hard for me to lose weight? Why, like, I know what to do. Like, this is what I do for a living. What causing me to, like, my detox pathways not to work? And I think back of when I was a kid and all those steroids getting from time I was like 7 years old till I was like 11. That's a lot.
Mm-hmm.
So my vagus nerve was totally shot. So that's what, now that I know that involuntary bulimia, like I didn't want to throw up. My vagus nerve was actually contracting and was overstimulated and making me throw up all the time.
So let's talk a little bit about the vagus nerve. This winding nerve that goes from our brain and down to our gut and has all these branches that go to all of our organs and how it plays such a role in our sympathetic and parasympathetic system. And again, I don't think a lot of people realize they're in the fight, and they're in the fight every day. Like you said, the bear's chasing you, and it just seems norm, right? So you wake up and you're tired, and you get your coffee and off to work you go, you work hard, you checking your email, you're on Instagram, and you get home, you're dealing with the kids, or you're going to work out because we've got to work out harder because we're going to try to lose weight, and all this kind of stuff. And then nighttime comes and you're checking again, and then you go to bed around midnight and you're not even sleeping well because your phone's next to your head.
Yep.
You can only go so long until something breaks. But the thing that breaks is us, our physiology, and it's brought out in symptoms. And
yes.
So we can take this medicine for a symptom, right? And that seems to be pretty normal. But, in our field, we got our folks who say, well, take this vitamin for a symptom as well, right? And that doesn't always work, right?
So doesn't always work.
You got to be considered. So when we look at that, and then you look at what colon therapy can do, and I love the idea that it's not just like in and out for an emptying session. It says, you talked about it in your book, how you're setting that environment for healing. You're setting that environment for parasympathetic tone.
Yes.
So can you talk us through, like, what's it like when we come in as a patient? Like, we're going to see you, and some people are very modest, and they're like, listen, I don't want to take off my clothes. They're like, am I going to have to be naked?
Yeah.
And to you and I, the body's the body, whatever you feel comfortable with, right? But that in itself, that
puts you in that sympathetic mode. Exactly. You're already like that. How am I going to get you to release when you're like, I got to be naked in front of a stranger on a bed, and you're going to touch me.
Right. And your sphincter is like touch shade already. You're not letting
really
it
tight.
Right.
So, exactly. And do we know that the beginning of the digestive tube is our mouth, our lips. The end of it is the colon. So I actually have my clients, depending on, again, from how their personality is coming in, if they're very tense, I don't put on relaxing music. I actually have them talk. The reason why If you hold if you're listening to music and you're relaxing, but your mouth is pierced tight, this is the beginning of that you're holding this. Of course, your anus is going to be tight as well. So as I make them talk, they're relaxing the muscles here. They're relaxing their lips. They're also relaxing the anus, and everything just flows properly through. Now, we talk about the gut brain connection in the vagus nerve. So the vagus nerve starts at the brain stem, and it's actually the 10th cranial nerve is the longest nerve in the body. But it's actually two nerves that comes into one on both sides, the ventral and the dorsal parts of it that comes in and comes down into our from the carotid and come down into the center, and then they branch out. But think of like when the egg and the sperm meet. They meet, there's this exchange of electrons, they join, there's multiplication, and then it turns into a neural tube. One end of the neural tube is the brain, and the other end of the neural tube is the colon. So they are connected by this long vagus nerve in the center. So whatever is going on in your gut is going to affect your brain, and vice versa. It's a two-way street. And so if your gut is filled with bad bacteria because you're eating a lot of processed food, you're drinking a lot of alcohol, you're stressed out, you're killing off all these good bacteria, you're not gonna have the right signaling up. So these microbes, we have over 100 trillion microbiome in our microbiome going up this vagus nerve, connecting and kind of like the communication wire from our gut to our brain. And so they're communicating so fast that we don't even realize that it's happening. Think of like if you're in the parking lot of Walmart, and all of a sudden it's dark, the lights are out, and all of a sudden you get this airy feeling. The first place you feel it is in your gut, and you'll hear gut feelings. I think Dr. Will Cole just came up with a book called Gut Feelings. But you feel it in your gut first, and then your heart changes. You get that palpitation. And then your brain goes, okay, grab your keys, grab your phone, call someone, something. But it happens so fast you don't realize it. So I know that we were taught that the gut is the second brain. But for me, I consider the gut the first brain, because that's the first thing when you met your wife and you saw her, you're like, oh, I'm sure you felt it in your gut. We all think about when we were a teenager and you get butterflies in our stomach. You feel it in your gut first. So with colonics, I want to clean out all that gook and get the good bacteria to flourish more. You cannot, I forgot, there's a doctor, he mentioned it, stop chasing pain. And he said it so eloquently, you can't get well in the same environment that you got sick in.
Mm-hmm. I like that.
It was yes, like you can't say any clearer than that. So if your colon is dirty and I'm saying, okay, I'm gonna give you all these organic food, I'm gonna make you a vegan or a raw foodist, but I never changed the environment where all this bad bacteria is growing and parasites are festing and having a party, how am I really truly gonna get you to feel better? How am I truly gonna get you internally fed? You're gonna feel some improvement, but that's gonna be short-lived. So my whole thing with colonics is not just about getting stool out. It's about getting the stool out so that I can change the environment in there, get more good bacteria in there. I use the colonic tube as my looking glass, so to speak. So I'm looking to see when someone gets on my table, they have on a robe or I have on their bra on. I use different, either use acupuncture, I do acucolonic. These are colonics that I've made for myself based on me doing over 100,000 colonics. I've seen a lot of tushies.
What do you mean by that?
As a licensed acupuncturist, I do acupuncture. So sometimes when someone's coming, they tell me I'm chronically fatigued. I need 2 to 3 cups of coffee a day to just get out of bed. So I know that they don't have the energy to push their stool out. Sometimes they'll say, I can feel the stool there, but it just won't come. Or I have a bowel movement, but it's incomplete. Meaning that you go to the bathroom early in the morning, you go get your coffee, you go again, and then maybe 10 o'clock again, you go again. That was actually one bowel movement that was broke up into 3 parts. So you want to have one good bowel movement. The large intestine time is 5 a.m. to 7 a.m. That is when it is strongest energy flow. That's when its electrons are at its maximum. So you want to be going to the bathroom around that time. You get up in the morning, you oil pull, you drink some water with some lemon in it, or maybe some glutathione and some water. We'll talk about that. And then that will stimulate the system to help you go to the bathroom and release all those toxins. Because while you are sleeping at night, that's when the body detoxes is most, because it's like, okay, you're down for the count. I can now clean up all the stuff you picked up during the day and start cleaning everything up. That's when your gallbladder is releasing between 11 p.m. and 1 a.m. Your liver is releasing between 1 a.m. and 3. Your lungs start dumping out all their stuff between 3 a.m. and 5, so that all of that goes into the colon to be released between 5 a.m. and 7. So I want to make sure that I'm cleaning that out, getting good bacteria in there, looking to see if there's undigested food. Lots of people don't chew their food. We're here in New York. You see people walking down the street eating, on the subway eating. There's not mindful eating. You're not sitting down, taking a deep breath, getting to a parasympathetic state, and then eating. You're rushing. So you're eating in a sympathetic state. So I'm seeing undigested food coming out. And I'll tell people, oh, you had some asparagus today. Or you had, oh, that was nice broccoli floralette that passed by. And they're like, what? And I call it out because I'm not just gonna say, oh, I can see some food. And then they're like, yeah. But if I call out what you ate, you know for sure that I am actually truly seeing what is coming out of you. I'm looking to see how much gas comes out first, how long it takes for the water to turn color. That tells me how hydrated or dehydrated you are. When the water turns color, how long it takes to get from a light brown to a dark brown. That tells me another level of dehydration. So maybe the water didn't take that long to turn color, but as soon as it turned light brown, it just turned dark brown. I'm like, okay, things are moving. But if I'm there for 30 minutes and it's just like a light can, I know that that stool is so dehydrated. It's been sitting there so long and it is so solid. It's going to take time for me to soften that up. It's kind of, think of the soaking cycle of your washing machine when you're trying to get a stain out. Same thing, or your lasagna pan. It's burned, you need to sit there and soak and soften it up. It's the same concept in a colonic. So I'm looking for that. And then when I'm looking and I'm seeing undigested food and gas is coming, sometimes some parasites can come out. Now, I can't see all parasites because most parasites are microscopic. Or we have stuff like Giardia and stuff like that. But you can see worms coming out of the system on a regular basis. Even today, I had an amazing, I'm going to post it tomorrow. You guys are watching, I'm going to post an amazing, beautiful creature tomorrow on my IG and my TikTok. But it's just to show people like, and this person eats well, this person is super fit, exercises all the time, infrared sauna, I mean, you name it. And this creature is still coming out. So we all have worms. No one is excluded.
So the creature comes out. Is this creature moving?
Alive? Sometimes they're alive and sometimes they just die. So I was mentioning about doing acupuncture. Sometimes people don't have enough energy. So I'll do acupuncture on the body, but I'll also do acupuncture in the air.
Okay.
There's 5 needles that I use in the air called the NADA protocol. And that deals with emotions. So it's a physical and emotional release colonic. So if someone's just telling me like, oh, I'm really stressed out, I have an issue with my husband or a coworker or something like that, I'm like, would you mind if I do some acupuncture in your ears? And they'll say yes. And I'll put these needles in a specific order. And sometimes they will shut down in the sense of get very quiet. Or as soon as I start putting the first needle in, the tears just start flowing. By the time I put all 5 needles in, the tears are flowing. Sometimes people don't talk to me. Sometimes in the middle, once things start to move and that thick sludge starts coming out of the body, people either start to cry, get very quiet, or they start calling me the B word. I don't take anything personal because my goal is to get this toxin out of your system. I always tell them, this is sickness leaving your body. I don't care if it comes out in liquidy or pebbles or a log. What I'm seeing coming out of you is sickness leaving your body. You're going to leave here, whether you came in to look sexy for a wedding, whether you came in because you're bloated, you're going to leave out of here more internally fit than you were when you walked in. And that's my goal.
That's beautiful. That's a beautiful goal. So when someone is on the table, how long are they on the table for?
They're on the table for 45 minutes to an hour.
Okay.
Now, if I do a separate acupuncture session, they'll do 30 minutes first, and then of acupuncture, then a colonic. I also do a lymph colonic, and you can do a lymph colonic during the colonic, where you lay on a beamer mat, which is a PEMF, pulse electromagnetic frequency at a low rate, which increases microcirculation of the capillaries and the lymphatic system. So the colon has so much blood supply. It's insane how much blood supply goes through the colon. But also 30% of our lymphatic system is in our gut. That little small area, 30%. So how can we ignore it?
Right.
I don't understand it. We don't, even in school, we didn't talk much about the lymphatic system. I had to go and take extra classes to learn about the lymphatic system. I studied the Voter method. I studied Chikli method, which was amazing. So that I can take all these different modalities that I have separately and put them in with colonics to make the colonics work much better. So using electromagnetic frequencies in charging those cells, because if your cell voltage is low, below between negative 20 to 25 is great and normal. But if you go below that voltage, then your cells doesn't have the energy to even dump its own toxins, much less have your body release the rest toxins. So when people say to me, oh, you don't need a colonic or enema, my body can release it on its own. And I go, well, how often are you going to the bathroom? Oh, once a day, once every 2 days, once every 5 days. I'm like, well, how often do you eat? 2 or 3 meals a day. So what happened to the meals that you ate if you only go to the bathroom every 4 days? It's still sitting in your system, and now you're going to become, it's called toxemia. You're now reabsorbing all those toxins back into your bloodstream. They went through the liver, first phase 1 and phase 2. So they went through that. Now those metabolites are even more toxic coming back out than they were when they went in. And then the cholesterol rises because how the body gets rid of extra cholesterol is through your bowels. But if you're not pooping, then you're reabsorbing that 80% of the cholesterol you're supposed to release. You're reabsorbing that, and now your cholesterol rises.
Right. So simplistically, the trash isn't being taken out.
The trash isn't being taken out. Think of your kitchen garbage. Maybe you only change the garbage when you poop.
Right.
Not cool.
Right. And you can get away. Maybe you think you get away a day, a 2, a 3, but eventually things are going to happen, right? So we see that. So when we talk about constipation, when I talk about constipation with my patients, and that's one of the primary complaints we get, it's either I have no feeling to even go. So that feeling to even start to go is not there. That's one. 2, I go, it's small pebbles. You talk about the Bristol stool chart, which many of us are familiar with. And it's like, rabbit charts. It's small and, it's horrible. Or I go to the bathroom and it's like a wrestling match, right? I'm squeezing, I'm pushing, which can lead to internal and external hemorrhage. It can lead to increased, blood pressure.
Sure.
There have been people who, pushed and died on the toilet kind of deal. So
yes.
When you do your colonics, and that's great, that gets that out. Is there an instance where, hey, this person is getting colonics, now this is doing the job, and it's not allowing them to return back to that proper parasympathetic turn? Like, where does this, where, okay, we can help it, but how do we help this person to, like, okay, get going, and now you can keep going? And I know there's many other things we have to work on, especially, our brain.
That's a very, very, very great question. How I do colonics, is I find that when I would get colonics, and most people, they would fill you and fill you and fill you and fill you till you're like, and then release. I do not do colonics like that. And the reason why is the colon is a muscle. If you go to the gym and you're going to do, I don't know, a bicep curl, you don't go like this and sit there forever. You go in and out in a rhythmic fashion. And that's how I do colonics. I try to mimic the peristaltic movement. So the peristalsis is a wave-like movement of the colon to push the stool through each hostra. The hostra is the little loops in the colon. Oh, I left it over there. I should have showed you and brought it. But there's little loops in the colon, and you want that peristaltic movement to go through. So I want to stimulate that by going in and out. Say if someone has a lot of gas, 3 seconds and release. 3 seconds and release. And then as that gas comes out, and you can hear the gas come out, then I can maybe go to 5 seconds and release. And I'm trying to allow your gut and your brain to remember, oh, yes, I remember that. That's what I'm supposed to do. And then it picks up and do it on its own. And then you can actually feel it in the tube, but you actually start doing it yourself. That's the goal of the colonics, to not to catch you up on like all your backlog, but also retrain the colon and the brain connection so that you can learn to do it yourself. Also teach you how to eat differently, how to make your digestive stronger, your enzymes, your hydrochloric acid, all your probiotics or fiber or fermented foods, to create a perfect, beautiful environment for these microbes, which is your immune system, which again is in your gut. But when we say gut, I think when we say our immune system is in our gut, I think it sounds so clean. Your immune system is in your colon. It just sounds different when you say gut, because then people say, oh, it's in my stomach. No, it's in your colon. So that dirty place, if that colon is dirty and this is where you want to house your immune system, goes back to what I said earlier. How can you expect to be well in the same sick environment that you became sick in?
Which makes sense, because you're trying to change the
environment,
the ecology of the microbiome, right? So
yes,
I really like that a lot, because if that is a better ecosystem, and the ecosystem is now working better, by default, hopefully that increases the immune system. The secretary IgA, the immunoglobulin A, is better.
Exactly.
First line of defense, which is created, as they say, in our gut, but you're correct, it's in our colon. So I mean that's really important. So to tie up this whole colon therapy thing, and then when I want to get on to talk about food, because obviously they're related, if you can touch base on the poop transit, that whole digestive. So it starts in our mouth, it ends our anus, somewhere it gets caught up. What happens?
It gets a backlog, like a traffic jam on the FDR drive. It gets backed up, and the more it gets backed up, the longer it sits there, the more water gets pulled out. And as the water gets pulled, it gets drier and drier. And it's kind of like your impactor, and one of those impacting machine for like for cans, and it just squashes it and squashes it. So it gets harder and harder and harder and sits inside your system. And if that's sitting there for a long time, after it's hard for you to push that out. And you shouldn't be pushing it out. Most people don't know how to go to the bathroom. It's something that we should have been taught of at school. I think what we're talking about today is something that should have been taught from time we were in elementary school. It's something that I would love to go into a school and talk to kids about, how to go to the bathroom, how to sit on the toilet. These are important things, because these are the things that they're going to be doing for the rest of their life every single day. So how you're sitting on a toilet, if you're just sitting on a regular modern toilet, which is like an L shape, you're not supporting the ligaments that allow the colon to turn and push everything out through from the sigmoid, because the sigmoid has this really weird turn S shape. And so you need your thighs to push up against that so everything can come out. So you want to make sure that you're in a squatting position per se. There's Tushy. There's they have like a little bench on the floor that you can put your feet on. A lot of people are familiar with the squatty potty. Sometimes they say, "Oh, the squatty potty is too big." I'm like, "Okay, here's a little Tushy is really nice. I love it. Small. It's discreet. It gets out of the way. I use one at my office too, so people are like, "Oh, I like that," because it's again, people are still ashamed of going to the bathroom. So the squatty potty is like telling people like, oh my God, I poop. Well, you got a toilet, you do poop. And if you're not pooping, you're dead.
Right.
Plain and simple. So when you're holding on to all that stuff and you're pushing and putting all that pressure on the veins and the hemorrhoidal vein, and then it pushes on, you get a herniation of that vein that comes through. Now, the fastest way to get medicine in your body, because you talked about medicine earlier, is through the colon. Because think of it this way, when you eat something or you take your supplement, it has to go through your digestive system, it has to be broken down, the liver does what it needs to do. By the time it gets to your bloodstream, you already lost 80% of what you were supposed to get. But if you do medication through the anus, like say chlorophyll, or why coffee enemas became so popular, is because it goes straight through the sigmoidal vein directly to the colon, to the liver. The liver does its thing. It releases its S-transferase enzyme to release glutathione, which is the master antioxidant of the body. And voila, the liver starts dumping all this gook out. The bile starts releasing all this dirty bile. The bile is supposed to be that like bright neon yellow color that from that highlighter in school.
Mm-hmm.
When I see bile coming out, it's like the color of my book. It's like a burnt orange color. Not good. So it's dirty, and it's a detergent. It's supposed to clean things out. It helps to alkalize the acidic food coming down, and out that fire so that it can release the extra toxins as well as the cholesterol as well. So I find that holding on to all that stuff, the body goes, the body wants to live. I need to get this out. So how am I going to get her attention? I'm giving her a headache and she's not paying attention. Aha, I'm going to deal with her skin. We are all vain. Our skin this is the first thing that the world sees. So the body goes, I want to stay here. I want to enjoy what this beautiful world has to offer. So I need you to pay attention to me. So I'm going to give you acne. I'm going to give you rosacea. I'm going to give you eczema. I'm going to give you psoriasis. How many people wake up in the morning, they see a pimple, immediately they pay attention, they go see a dermatologist, they're on it, they're researching, they're Googling, but they've been constipated for years and they go, because nobody can see it.
Right.
So I find that skin issues is basically you're pooping through your skin. The skin is the largest detoxification organ. And if you're not pooping through the anus, the body is going to try to find a way to get those toxins out. And the largest way is through your skin. We're supposed to release sweat, and that's where saunas come in and so forth. But it will release toxins however way it needs to.
You had mentioned coffee enemas. I had a colleague and good friend who had parotid cancer. And this thing was large and it would seep and give him a lot of pain. The only thing that really reduced his pain was coffee enema. And he would say, like, after he would do that, everything was just so much easier. Everything was so much easier, right? And that is not conventional thought process by any means.
But it used to be. It used to be back until the Merck manual, which is the Bible for the AMA,
right,
used to have colonics in there up until as a way of cleansing the body and a way of healing up until 1977. And then you can make more money are you going to make more money seeing 5 or 6 people a day, or if you're seeing, people for 7-10 minutes and you can get 20-30 people in a day?
Right. I mean, obviously that's what it's becoming, right?
And that's what it has become. Yeah. So no one wants to take the time.
Right. But let's also share that when we're talking about coffee enemas, we're not talking about like a rundown Starbucks, right?
No.
So let's tell everybody, like, don't run and go get, a mocha latte and start using that,
You can't? Not a cappuccino? Oh, darn. Okay. Well, no, there's a specific.
I'm telling you, you can't. You shouldn't do that. I'm
no,
telling
you shouldn't.
It didn't work.
I was being sarcastic.
Right. I'm telling you, you know what? I didn't work. It was a bunch of crap. All right, I couldn't. Had to throw one in there for you.
Yeah, I know.
Couldn't help it. So
exactly.
If you can share with people that we're not talking about, and you mentioned in your book, what type, we're not talking about, a Folgers roasted brand, right?
Right. The brand is S.A. Wilson coffee, and they have a light roast, a medium roast, and a dark roast. The light roast, which is more like a greenish coffee, is very strong, and so that was the preferred one for getting toxins out. They used to use that at the Gerson therapy. I also went to the Gerson therapy and did the whole protocol. And this have now switched to the medium roast, so it's not as powerful of people getting the reaction out. I love the green coffee, the first roast, but you can change it up between medium because the amount of caffeine that's in there is not for you to drink. The caffeine is to actually stimulate the liver to release the toxins. And that's the thing. And the mechanism for pain is amazing how you can do a coffee enema and you could be in so much pain. Like with my knee, for instance, I had total knee replacement. And the pain meds, I was just like, okay, this is way too much pain meds. And I was good enough that I could walk across and go get to my office and give myself a coffee enema before I finished the colonic. My pain was gone. It was down from if I went in at a 10, it was like a 2, instantaneous. And so they've used that to help people with cancer just be in less pain. They already have so much on their mind, their body is going through so much that at least if you can reduce the pain, you reduce the suffering. And so you're helping to not just reduce the pain, but reduce the toxicity in the body. And the liver is the most forgiving organ, and it can regenerate. And every 6 weeks it does, if given the opportunity to. So you want to make sure that the liver is able to dump all its toxins, all the stuff that the chemicals from our cleaners and our hair and the fancy lotions we put on our skin and the dry cleaning and all these things. All that stuff is in the liver. So you need to release that. All these things stay in our system and cause dis-ease in our bodies. Whether you want to call it cancer or diabetes or MS or arthritis, these are all toxins that have accumulated into an area that is sitting there causing a tumor or something that wants to get out. So I find that coffee enemas really make a difference. And you can see the difference in the colonic, the sludge, slow sludge. It's like you're having a volcano erupting and you have this red lava. Instead, it's just this really dark brown, slow moving mud that's coming out of your system as your body's releasing. And people will say to me during the colonic, why am I feeling this tingling and this weird feeling in my left leg? I'm like, the body drains from the left side. That's the toxins that were stored so deep in your body coming into the bloodstream to be released out of your system. Just breathe. I give them essential oils. Different essential oils help to create a different reaction in the body. So while the coffee is doing its thing, I will do essential oils to help them. Essential oils have a frequency. We all have a frequency, a voltage. And so different essential oils do different things, but also they have a frequency to help our cells vibrate on a different level as well. So my colonics it's more of an experience than a colonic.
Right. And that's what I liked about it. And that's what really came through in the book, that, we're not coming in just to get cleaned out. We're coming in to get well. Right. And that's the difference. That's the difference between a technician and a therapist.
Yes.
Right? We're coming to you for root cause. We're coming to you for overall well-being inside and out. So, and I really appreciate that. We can't talk about colonics and the microbiome without talking about digestion, this whole acid alkaline approach. Are we more acid? Are we more alkaline? We got those who have a tremendous amount of acid. It's coming up through their esophagus, through their stomach, and they're on omeprazole, the Prilosec, all that kind of stuff. They're on it. Once they get on it, they're on it for years. So that's a condition. There's always digestive issues that's involved. So can we talk a little bit about this acid alkaline balance and what we're really looking for?
So yes, it's all, again, you said the right word, balance. It's all about balance. And most of the time when we hear, 99.9% of the time, when you hear someone has acid reflux, indigestion, another word, GERDs, gastroesophageal reflux disease, they feel this burning coming up. And so they think it's too much acid. It's actually the opposite. It's actually that they don't have enough acid. Now that sounds really weird because you're like, Tracy, I'm burning. Of course I have more acid. No, you don't. You don't have enough acid in the stomach to actually close that sphincter, the esophageal sphincter, to keep it closed. There's a certain pH of the HCl that has to be in order to activate that sphincter, the esophageal sphincter, to stay closed. And if that pH is less, more alkaline, then it opens up. So you want to make sure that you have a high, and this sounds confusing, it's a low number of pH, so say 2.5 in HCl. You want that to be high so that you have enough acid to break that food down. When we eat and drink at the same time, when those acids start to degrade in our system, or we have a blood type that doesn't make enough hydrochloric acid in our bodies, then we end up you eat something, we didn't chew it properly, we drank with it, it's churning and churning, trying to break that food down, and some of that fumes come up, and that burns the esophageal lining, which is very, very sensitive. And so we get that over time, and that can end up leading to something called Barrett's esophagus, where we start seeing some changes on the lining of the esophagus. Now, over time, that can go further down and lead to ulcer, and that can go further down and leads to some burns in the small intestine, and go further down and lead to ulcerative colitis or Crohn's. But at the base of it, it goes back to digestion, and not just what you eat, how you eat it, and if those digestive system is supported with the proper digestive enzyme and hydrochloric acid that your body naturally makes. And if you're not making enough because you don't have enough of the raw material or the raw cofactors, then your body's not going to make the hydrochloric acid, and then you end up having low acid and go to the doctor and get a omeprazole or Prilosec, which is supposed to just be used for a short period of time and stopped. A friend of mine, Dr. Stephen Holt, he was said to me, said Prilosec was made to just out the fire for a little bit, and while you fix the bigger thing. And unfortunately, it's given, and then you're forgotten, and people just forget. The doctors forget, and then they just keep you on this for a long time. When you have this thing, a low acid for a long period of time, you're now not going to be able to make B12 or absorb B12. So of course you're going to be tired. You're not going to have it. You need that hydrochloric acid there so that you can make intrinsic factor when the B12 comes in. It's kind of like you're dating. So you have B12, you have intrinsic factor, and they're like meet by the stomach, and we're going to court, and they're going to go down the stomach together and talk and talk and talk. And then when they get to the small, they're like, oh, you know what? I like you. We have similar things, and then they join together, and that's when the B12 becomes active and you can use it. But if you don't have enough hydrochloric acid to make that, then you have B12 hanging around, and you're still saying, I'm tired, because you didn't have enough intrinsic factor for them to it's like you're single through your whole life.
Right. I mean, you can go to Costco and get like a case of like Prilosec.
I know.
Like a case. So you can get like a case of Yoo-Hoo and Prilosec, right?
And Prilosec.
Right. So, I mean, they've done their job, right? I mean, it's great.
For sure.
People can afford it, so that's okay. Get it at a better price, but it never really changes, right? So, I mean, from our perspective in our world, that's where like when people want to come off of the medication, they speak to their doctor, and as they're titrating downwards, we're using aloe vera, we're using marshmallow root, we're using slippery elm.
Mm-hmm.
These the DGL, these things that really just help the esophagus, and they can come off of it, right? So that team approach is important. So we're not saying come off your medicines, you're saying there's a way to do it for sure.
Exactly. It's exactly. And because people are like, well, if I just come off, I'm going to have all these issues. Like, what are the things that you can change in your diet? Because this is a lifestyle situation that's going on here that's causing this to begin with. So Are you drinking coffee? Are you drinking alcohol? Are you drinking carbonated drinks? Are you drinking a lot of having a lot of carbohydrates? Some people, they have no issue with coffee or alcohol or carbonated drinks, but the minute they have carbs, whoa, that goes like off the rails. So
Right.
I'm actually working with someone right now, and you know, with that same exact thing, just the carbs is what turns him into so much pain, and getting him on the right amount of hydrochloric acid. So we're all not the same. So I have some clients where they can take one hydrochloric acid and the enzyme with a meal. Some can take two. Some have to take up to 15 because they have gone so long with not enough stomach acid that they need that much to start stimulating the fire to come back. It's like the fire has been out and it's just smothering, and you need to add some fuel to keep that to get that fire to catch that fire back again.
Right.
And so, so people are like, well, 15, tablets before. And I remember, this patient, I said, okay, I think you've been on that for a long time. I think we should start cutting down. And as soon as she cut down, all her symptoms came back. We were like, wow, you're that low in hydrochloric acid. And her blood type was a blood type A, which genetically makes low stomach acid. I'm a blood type O, so I make lots of hydrochloric acid. But as we get older, our bodies genetically just stop making as much. So you need to supplement.
Right. I think that's really important. I mean, I like to start supplementing when we're doing like a betaine hydrochloric. We start low and then we start building up to see where we're at, right? Because we don't want that.
Where's your tolerance?
Yeah, we don't want that burning pain either, right? Because then the patient gets, worried about the burning. So when
I tell them to get to so say you get to 6 and
right.
you get a burning, then your dose is 5.
Right.
So that's how you know what's the number for you, not
right.
what I'm going to tell you to take. You have to get to that point, to that threshold. When you get that acid reflux come back, then okay, maybe it was at 3, then your number is 2.
Right. I mean, everybody is truly the N of one, right? It's the individual, right? So it's like people say to me, what vitamins and supplements should I take? I'm like, I don't know what's wrong with you. What does your blood work look like? What did your blood? I mean, I literally don't know.
No.
I don't know.
Yes.
I don't know until we figure out what you as an individual, what your physiology looks like, and that's where, those great intake forms and exam comes into play. So when we're talking about food, you talked about in your book, food combining. And, people think that, well, I did combine my food. I had a protein, I had a carb, and I had a fat. So that's combined. Everything was great, right? And, it's interesting because when we have people on the elimination protocol, I'll have them eat like a piece of protein and they're fantastic. Maybe they'll have a piece of chicken, they'll have a piece of steak, and they're doing great. But the minute they add in I'm just going to have a little bit of this and the quote unquote grain-free, gluten-free pasta, boom, someone just bloats.
Yes.
Headache, right? So, let's talk a little bit about food combining.
Yes. I remember when I went to my first colon therapist, and I was just at BU, and I remember saying, she said to me, I said, well, I just, I go to the bathroom 3 times a day, so I just need a little cleaning out, nothing much. And so I'm getting my colonic, and it's just really uncomfortable, a lot of bloating, a lot of gas, just horrible. And she's telling me that she's seeing some undigested food and blah, blah, blah. And so she was like, so she started asking me about food combining. And I was like, okay, all right. So being a, intellect. So she asked me the question. She goes, how long does it take for your body to break down carbs? I said, about 2 hours. And she goes, then how long does it take to break down protein? I said, about 4 or 5 hours. And she said, fat? But she was acting as if she didn't know, but she didn't know. So I said, fat about 6. She goes, so if the carbs is breaking down in 2 and you're mixing it with a protein at 4 and a fat at 6, what's going to happen? And I was like, oh my gosh. So the body's going to be like, I got to work on this steak for 4 hours and let me get started. I'll wait on this carb a little bit longer. But now that the carb is sitting in the body longer than it's supposed to, it starts to ferment. And now we have all this bloating and gas and feeding or Thanksgiving, as I tell my clients all the time. I'm like, the bad bacteria is like, yes, Thanksgiving, woohoo! Because now it's sitting there longer and now it's starting to ferment and making a perfect environment for them, perfect food for them. And so you're having all this bloating going on in your system because the food is starting to rot. We're saying ferment, but it's rotting inside of you. And if you're going to the bathroom and you're feces is smelling, yeah, that's called rot.
Hmm.
So I try to get my clients to do greens, which works very well with carbs, greens that goes very well with protein as well, so that you have that roughage. You also have the green, which is very alkaline, to go with the acidic food. So carbs are acidic, but meat is more acidic than carbs. Chicken is less acidic than a steak. So you want to have balance, 80% alkaline with 20% acidic. You also have that 80% of green. So you're getting that roughage in there, you're getting that chlorophyll in there, you're getting that raw electrons in your system, along with a little bit of acid at the same time. So it's not like you're just having steak, but you don't want the steak sitting there and just fermenting. You want to make sure that you have the roughage to help it move through your system. So I always have my clients do a salad, greens with the carbs, or salad and some vegetables with their protein and the fat.
Yeah.
So in other words, don't have your dessert of fruit after your dinner. That's a big no-no.
But wait a second, fruit is healthy.
What, fruit?
Fruit is
Fruit.
healthy.
So okay. So
you don't understand, Dr. K. Fruit is healthy. I'm like, okay.
I know. Fruit is overrated in the sense of you can have fruit on an empty stomach before your meal. And if you're doing a berry, which is low glycemic, 20 minutes, you're fine. Banana is a sugary and more dense fruit. So that takes about 45 minutes. Melons, 15 minutes, they're through your system. There's a whole thing that they're saying when I went to the school in Canada. It says melons, eat alone or leave alone.
Right.
So you don't want to mix watermelon and these fruit baskets you see in the store with like everything, a conundrum of whatever. And then people are like, well, I'm eating fruit, so of course this is healthy. And they're doing this first thing in the morning. So after your body did all this work at night of detoxing, you reward it with a ton load of sugar first thing in the morning.
Right.
A smoothie with like 6 different types of fruit in it to break your fast, because that's what breakfast is breaking your fast. If you're going to have a fruit, have some berries. That's it. Not berries and a smoothie, or you're having a coffee and then you're having orange juice, or then you're having a toast, and it's just like, and I'm like, just go to McDonald's and have a meal. You had the same thing.
Right. And then I'll see the patient, I'm like, why don't you just have a couple eggs? They go, oh no, that has cholesterol in it. And I'm like, okay.
I know.
Right.
But also we have the whole thing with like eggs. That's I'm glad you brought it up, because people don't want to eat the yolk. They just want to eat the egg white. That is so 1980s.
Right.
The nutrients that grow this egg to a chicken is in the yolk.
Right.
The nutrients is in the yolk. So why would you not eat the nutritious part of it?
Right. And most people are sensitive actually to what's in the egg white, not in the egg yolk. Right. So when we look at, egg sensitivity, it's happening in the egg white.
Egg white, exactly. But
sensitive lysosome, albumin, all that kind of stuff. So, it's amazing. But again, it's when I have a patient who puts 2 large bananas in her smoothie every morning and says to me, I feel bloated. I'm like,
well, she just fed her how you say her kids, her bad bacteria kids, because they were just like, thank you, mommy, for all this amazing sugar. And sometimes we think about, you hear ADHD, ADD, and this is a little controversial, but I've worked with where their kids were labeled ADD, ADHD, and they'll come to me. I was working in a place in Long Island City, and they were going to put her son on lithium and special ed. And I said, well, wait. They're like, oh, they're going to this whole meeting now. Anyway, I said, can we just have a consult and like what your son is eating before he goes to school? Because he's not paying attention in class. Well, I don't know. He's having cornflakes for breakfast. He's having orange juice. He's having milk. And then on his way to school, he goes to Dunkin' Donuts and gets some donuts and a Coke from the corner store. And then he goes to class, and you want to know why he's like this and not paying attention to the teacher. I don't think that's ADHD. I think that's a sugar rush. So were able to wean him back off of it by explaining to him, like, if you don't do this, you're going to end up in a special class and get this medication. So we were able to get him to actually listen. And by the time they had the meeting, he was perfectly fine.
That's fantastic. Yeah. I mean, not that there's not attention deficit disorder.
Not exactly. There are some, but some of the times you have to look and see what is the lifestyle at home? What are you eating? And that goes to like, this is such a topic I've always wanted to talk about, and I've never been able to. And I talk to this with my clients, my females, on getting their body ready to get pregnant, cleaning the body out, getting rid of the toxins. The liver is the organ that everything filters through. From the liver comes the placenta and the umbilical cord that goes into this baby. So whatever is in you goes into this child. The way a woman gets rid of half her toxins is by getting pregnant. A woman gets rid of half her toxins by getting pregnant, and that goes through the placenta, which means it would behoove us to try to clean our bodies out as much as possible, just in case we get pregnant, so that we have less toxins in our system, less toxins in our colon, less toxins in our liver, less toxins in our lymphatic system before we get pregnant, so that we pass on less of our toxic burden to our kids. When we get pregnant, we have to stop looking at we're getting pregnant and we're having a child. I think we need to look at it as we're getting pregnant to make our future generations. And I think this is very dear to me, because I think if we look at it from that perspective, that we are making our future generations, I think we'll understand what I'm talking about more and not get defensive. I am weaker than my mother genetically. My mother was weaker than her mother genetically. With each generation, we get more and more weaker. So I'm working with a couple of ladies right now, and one in particular that have been with me for a year. And when she came to me, she's been strictly vegetarian her whole life. And we were working, she came to me, Lyme disease, chronic fatigue, ITP, you name it, she had it, thinning hair, exhausted. And we've been working nonstop for a year. And I have watched this young lady completely change her skin, her hair, completely change before me into this like vibrant being. And I said to her, I said, do you understand that from all this cleansing and nourishing, detoxing and nourishing, so you can't just detox, you need to detox and nourish together, that your child and your grandchild is going to be stronger than you, your mother, and your grandmother, because of the amount of commitment that she has put into cleansing her body and nourishing her body before she can get pregnant. It's the most, it makes me love what I do so much more than anything, because I can see my clients come in one way and within 45 minutes change. When they come to my retreat upstate, and I started the retreat with just 3 days to show people what 3 days can do. It would be great to do a week or 2 weeks, but it's a lot of commitments. So I try to show them, hey, look what can happen in your body in just 3 days. And then they say to me, I'm ready for a 5-day or a 7-day. But clearing out the system and getting getting pregnant. Like I've had clients where it was hard for them to get pregnant. They clean out their bodies. I'm like, just give me 2 months. And they're like, I'll give you 3. And then they're pregnant. Because the body's like, some people can get pregnant. Their genetics are just amazing. And some people, like, the body's saying, I am so full, I don't have room for this baby. So I need you to clean me out. And sometimes I've had situations where people have gotten pregnant and I've had a miscarriage in the first trimester and then they get pregnant right after. And I'm like, sometimes that's the body's way of cleansing, cleaning house to make this beautiful bed of blood and nourishment for the upcoming child.
Beautifully said. But you also said, weaker than your mother, and your mother's weaker than your grandmother. So how are you defining this weakness?
And genetically, we have, they say, with think I'll use my grandmother for instance. When my grandmother grew up, the foods that she was eating, the environment that she was in was less toxins, less chemicals. We now have 100,000 more chemicals, man-made chemicals in the air than we did growing up. Even in the 70s, growing up in Tortola, where I was grounded to the earth, and I ate no processed food. Everything was at home, and we drank filtered water from a spring. All these things, compared to now, where we're drinking water from a tap. We have Wi-Fi on all night while we're sleeping. We have Wi-Fi. We have blue light. We're eating out all the time. We don't know what these restaurants are cooking our foods in. We're using vegetable oils. We're using oxidized oils. All the chemicals we use to clean our house, we're putting on. As for women, before a woman leaves her house in the morning, she has put on over 50 different chemicals just on her face, in her pores, that she's eating. Our pores is our largest organ of detoxification, but it's also our largest organ of eating. So we're putting all those toxins into our system. So when people say, well, I don't need colonics, my body's supposed to release this. And I'm going, but you're constantly, every day, this is what we're doing. We're putting on deodorant, and we're not paying attention to like a natural deodorant. We're putting on a nice scented lotion. We're putting on perfume. We're dyeing our hair. So the body's constantly trying to catch up. Whereas back in the day, women didn't care. Their hair got gray, your hair got gray, your hair got gray. They weren't wearing makeup. I never saw my grandma put on makeup. I saw my mom put on makeup when they had to do like a picture for work. Mm-hmm. Now people won't even go down to take out their garbage unless they're completely made up.
Right.
So that's why I say that we're weaker, because now our systems, genetically, we're passing on these toxins, and the environment is more conducive for more toxicity. We now have glyphosates when we didn't have that back in the day.
Everywhere.
You can't even get glyphosates out.
Right. So hence the importance of the cleansing, right? More yes, now than ever. I want to touch base on the cleansing, because I'd be remiss to not talk about that. And I said, like, when we opened, I've had people that come to the office and they've gone through cleanse, and they're not healthy, right? Doing the cleansing, they were not healthy. It was improper. It was something they purchased online. Now, I'm not saying anything online is bad. There's no particular brands per se. I do question some, but it wasn't a healthy cleanse. And when I read how you did your cleanse, I'm like, this really made clinical sense, right?
Yes.
Not marketing sense, clinical sense, right? So I want to, yes. It wasn't a special product you were selling to, take this and, this will leach your body out of this. And yeah. You were asking them to eat real food. Mm-hmm. I loved how you met them where they are. If you're a vegetarian or if you did eat meat, that's okay. I loved how you took them through week 1, week 2, week 3, week 4, and then you brought them back down. Because a lot of times people go through a cleanse and they're like, okay, I'm done. I went through the powders, I took the supplements, I'm all done, and right back to eating the pizza and cheesesteaks and the desserts and all that, right? So I really appreciated how you went through it and then came down, right? How you reintroduce everything again. And the one question I have for you before you talk about the cleanses is like, again, who should do this? Who should not do it? And being like an avid person who works out 5 days a week, I feel like, wow, if I did this cleanse, I'm going to need more than just this. Like, I don't know if I should work out on week 4 and do week 4. And to be
Right.
honest, I probably should take off a week of working out anyway, but that's what decreases my stress. And I love to work out, and I love to move, and I love that euphoric feeling afterwards. So who should do this? Who should not do this? What do we do if we love to work out?
Okay, who should do this? Everyone should detox to some form. And every cleanse is like in my book, like every cleanse doesn't look the same for each person. So, and some people might say, hey, I need to detox, but I'm already thin. I don't want to lose too much weight. Or they'll say, I can't gain weight no matter what. Well, they're probably too acidic, and so they're burning up. And so we need to, you're going to lose a little bit of weight, but then your body's going to come back into balance. If you're working out a lot and you're stressing your body out so much because you're working out 5-7 days a week, hardcore, 2-3 hours a day, because you want to, look this amazing external fitness. Yes, tone it down a little bit. Not to say you don't want to work out, but you could just change your workout. So maybe you're not in the gym 2 hours. Maybe you're going to go for a longer walk. Maybe you're going to do some rebounding, trampoline, some shaking, some walks, swimming, a different yoga, infrared sauna. You can burn 1,500 calories in an infrared sauna in 45 minutes. So there's different forms of exercise or ways of moving the body to get it, because you want to move the body. The body wants to move, and more so in a more spiral form. For instance, our DNA is a spiral. So our body wants to do more stuff of like not linear, more dancing and curls and like yoga and all these things to have it move in a different way. So I find that people can calm down their workout, do different types of workout, increase their water intake, not just water, but their minerals and their electrolytes, because you can take a lot of vitamins, but if you don't have enough minerals in your body to activate these vitamins as a catalyst, then things won't move forward. It won't work. So you're like, well, I'm taking all these vitamins and nothing's happening. Well, you didn't have enough minerals in your body to begin with, and specifically potassium, magnesium, calcium in a nice balance, and so forth.
So if somebody's on medicines, how do you feel about that? Because I'm always very careful when they're taking medicines and they're starting to do a cleanse. And, some medicines, require you to actually eat food. So, especially
and
like
so those people, yes,
and all that.
And if someone are on certain medications and they have to eat, so whoever you're working with to do a detox with or a cleanse with should be able to work the cleanse around you. Every cleanse is supposed to be individualized. So even when I'm doing a juice cleanse for my clients and they call me and we're doing a juice cleanse, not all the juice cleanses are the same. So sometimes I'll do like my juices and it'll have my logo on it, but it doesn't have a name, because I'm going to change it to what I found in your intake, your face reading, what we talked about, your labs, and then I'll change it for you, because you're an individual and you're going through your own journey. So someone needs to eat. Okay, so you come to, some people come to the retreat and we do all blended foods, living foods there, but some people, they have to eat something. So I make a nice little salad, or I make some sauteed mushrooms or vegetables for them. And it's going to slow down the detox a little bit, but they're still going to detox. So you have to just work with the person at where they're at. And that was my main thing with the book, was like, not to let anyone feel like, oh, well, if I'm not doing this exactly as you say, something's wrong with me, or, feel bad. Like, no, we all have to do things at our own pace. And I'm not running your race, and you're not running my race, and I'm not running someone else's race. You're running your own race. Stay in your lane and work on what your body needs.
Right.
Oh, there's Nico. I was wondering what was taking him so long.
Hello. I really appreciate that. Right. So I thought that was one of the greatest things that you talked about, is like, we're all N of one. You're doing yours, I'm doing mine. This is the pace. And you even talked about like, hey, if you're not ready for week 4, you don't have to do week 4. It doesn't mean you failed.
Nope.
you're gonna do week 2 again or week 1, and then you're gonna come back to it. And again, that's what I really liked about it, is because when you see a lot of the cleanses that are out there, it's like, this is the way it's gonna be, and that's it. And you see the patient come in and they're not well, right? So
They're not well, and they go back to eating the same thing. So when you do a cleanse, you want to educate them in a way that they're not just doing a cleanse or a diet. It's a change of lifestyle. So how, when you do this cleanse, when I have them go backwards, like, how can you incorporate this cleanse into your life and make it part of your daily living?
right.
So that's why I wanted to. I don't want people like, oh, well, I'm going to go back to eating pizza tomorrow, or like, oh, the cleanse is finished, oh my gosh, I'm going to dinner, I'm going to do this and this and this, and I'm like, no, you missed the point of what we just did.
Right. And it's funny because when we clean up somebody's, nutrition, a lot of times the kids or the significant other will say, when can we go back and start eating like regular normal food?
Yes, I'm like, this is normal food. This is the best food.
Right? It is normal food. That's what it is. We surely covered so much tonight. There's actually more to cover. We may have to do a second show. Right now,
I think Nico's like, you've taken enough of my mommy's time.
We're gonna get her back in a minute or so. So you had so many great recipes in your book. Which one do you like the best? Which one is your favorite?
Ooh, my favorite is it's a raw dish, and it's the deviled eggs.
Nice.
That's my favorite. And I have a friend, her name is Tess Masters, and she helped me with some of the recipes in my book. And also hooked on Raw, friend of mine, Rio. And so I had like some of my really close friends help me with some recipes, like Tess Masters. She wrote the book, The Blender Girl, and she has this one in there. It's like a raspberry lemon cheesecake. Heavenly. Jing Slingers, Jay and Joy Denman, they did the puffed Rice Krispies kind of thing. Quinoa is like a puffed quinoa dessert. Absolutely delicious. So, and there's a lot of raw dishes in there too. So I wanted to make sure that there was recipes in there that everyone can take home and do. Whether you ate meat, whether you were raw foodist, whether you were vegan, that you got something out of it as much as possible.
Yes.
So, but the deviled eggs is like my favorite. I make that on a regular basis.
Very cool. And my next question for you is, right now, what book are you reading?
The book I am reading I'm reading kind of like 3 books actually.
Yeah.
I'm reading Toxic Legacy. Toxic Legacy is by Dr. Stephanie Seneff on glyphosates. And I've been lucky to get this book, Gut Feelings by Dr. Wilco.
Gotcha. Excellent.
And so I wanted to read that because of when colonics emotions during a colonic, so much emotions are held in the gut. And sometimes people cry during a colonic. Sometimes they get very angry. I get them to talk about stuff that's bothering them. Sometimes they're so constipated that they're not physically constipated, they're emotionally constipated. And when I get them to talk about their feelings, the floodgates open and things just start to shift. And so I love doing emotional release colonics the most because I think people get the most out of it. Every physical disease that we have in our body have an emotional component to it, period. In Chinese medicine, the lungs and the large intestine are sisters. It's about letting go, but it's also about letting go of those feelings. Each organ have different emotions. So the lungs and the large intestine are grief and sadness. The liver, the gallbladder, deals with anger, frustration, irritability, resentment, anger, that kind of stuff. The spleen and the stomach, pensiveness, worriness, overprotection. The kidneys deal with fear. So I'm looking at their face, I'm talking to them, and I'm using different needles to stimulate those emotions to be released through the colonic, because we hold those emotions and we bury them in our colon and they sit there. Something happens right now. I'm like, a perfect example is this weekend. on Saturday, I lost a cousin of mine.
Mm.
And he would go and visit my uncle who's sick right now. And he was the one that would go and check on my uncle all the time. And I had a patient go into the room. I was waiting for her to get ready, and I got the news. I couldn't break down and cry, and this woman's on the table waiting. So what did I do? I sucked it up. I swallowed it down in my gut, and I went in and I did my job. I worked with her. I did what I had to do, and then I came home and I released it. But if you don't release it, or something else happened and something else happened, and we never get around to releasing those emotions, they're sitting there. And for me, colonics is not just about getting stool out, but it's getting those negative emotions, or whether, not to say like the sadness, but like a resentment and stuff like that, stuff that happened at work or whatever, that's stuck in the colon, that's stuck in the stool, getting those out so that you could truly heal. And those toxins have a positive charge, which are what we call electron stealers, and they lower our voltage. It's as if I came here, like right now, I'm so excited. I was so happy when I met you, and it was like you actually gave me energy. If I came here and I was like, "Hi, good night, thanks for having me here," would you really want to listen to me? There's no energy. Exactly. There's no energy. There's no life force. There's no voltage. So like Nico, he's barking. You can hear how strong his voice is. Nico is 18 years old, but you can hear the strength in his voice.
Mm-hmm.
I bring it up because I give him wheatgrass, I give him probiotics, and I give him enzymes. But you can hear how strong, how vital his chi is, despite that he's running around here like a crazy person at 18. So all of that is about voltage. We need enough energy in our bodies so that our cells can do what they're supposed to do. Our cells can dump out the toxins, and we can start making new and healthy cells.
Right. Did you ever read the book The Body Electric? That was all.
Yes, I have it. I have it right there.
That says right there. Okay. So my question to you is, like, you talked about a retreat. So are you having another retreat? When is that? Can you tell us like how we can come see you? Share us, your information.
Yes. So I am now in Carroll Gardens, where I live. At Cornerstone Healing. So it's 478 Court Street. In lovely Carroll Gardens. I absolutely love it. I have a retreat upstate New York. It's very secluded, so that Wi-Fi is low. The nearest house is a quarter mile. The next nearest house is a mile away. And the house is in the center, surrounded by pure trees, tall trees. So that is because we want to get as much oxygen into our system. There's a body of water. I have a pond, so we have water. I have a waterfall there. Waterfall signifies letting go. At the retreat, if someone wants to come and get a retreat, they can do a private retreat. They can come. I sometimes just wait for someone I'll choose a date, and sometimes that doesn't work for people. And I say, what date works for you? And that person will choose a date, and then all of a sudden people just call and bring in. So I have a retreat coming up in April, and I'm so excited about this retreat. One of my clients, Jen, came to my retreat twice already, and she invited some friends, 3 sisters. And so I call it 3 Sisters in a Friend Retreat. Nice. And they came, and the results of that was so fascinating, so amazing. These girls are super fit. They own a yoga studio. They're like the epitome of health and fitness, external fitness. And we were talking about, one of the girls was like, did I just lose 8 pounds in 2 days? And I was like, from where? I'm looking at it, I'm like, from where? But of all the stuff that comes out of your system from eating living foods and releasing emotions and all these things, like, it's amazing how you can hold on to so much stuff that you don't even realize that you have. Like, looking at her, she's like a model, and yet she had all this. She had 8 pounds that she released in 2 days. Wow. I had another person that flew in from Lithuania, and she had her own one-on-one retreat with just the 2 of us, which was great. It was her 5th or 6th retreat with me, and it was wonderful. I changed the retreat because people come and you're not the same person that you were a month ago. Mm-hmm. You're not the same person that you were a year ago. So she's always says, like, nothing's the same. Some of the treatments are the same, but there's always something different, and it's never the same retreat. And I'm like, no, that's boring. And also, you're not the same person from when I saw you, on the first retreat. So you have to work things out with people, what's going on with them, physically and emotionally and mentally. And funny enough, people that have the same energy actually come to the retreat together.
Isn't it interesting, right?
It's so amazing. I've had retreats where people have become such close friends that they have gone sailing and traveling together in Greece together.
Nice.
So they've created a nice bond, and they always ask me, how do you know how to put these people together? And I'm like, it just works. It always works its way out. It's beautiful, So yeah. So my next retreat is April. That's already full with these 3 sisters and a friend, but I can have one in March and then the ending of April. So I try to do one once a month. So people can call and just say, hey, I would like to come and join. And then I'll put that date out on Instagram, and then people will call. And then if you live in Brooklyn or Manhattan or the Bronx in an area and you don't drive, we will actually pick you up and drop you back home.
Nice.
So your retreat starts on the moment you get picked up with your mineralized water, your green juice. And when you come upstate, then we start all the treatments and the living foods. And when you go home, I'm a very good cook. You go home with your snack, your dinner, and your breakfast for the next day.
Fantastic. You can't beat that.
No, it's amazing. Yeah.
Any parting words?
Parting words. My parting words is to listen to your cells talk. So listen to them. Realize that listen to your gut feelings and put yourself first. Sometimes we forget to put on the mask on ourselves first, and we will take care of everyone else and forget about ourselves. And I think with all that's happened in the last couple of years, that we need to not wait until we get sick to do something for ourselves, to cleanse our bodies, to detox, to nourish. I think it's a perfect time for us to start increasing our voltage and getting better at taking care of ourselves. Right, Nico? Oh, he wants to come.
Hang him. Can he come to the picture?
I was trying to get him to come, and he is coming, I think. You know what? I'm gonna get him for you because he is. Hi, sweetheart. You want to say hello to everyone? Okay, he has on, yes, his red sweater.
Oh.
So this is Nico.
Hello, sweetheart.
There he goes. Say hi, everyone.
Oh, you are cute.
He's a cutie patootie. And see how much energy he has? Yeah. Oh my gosh. He's full of energy at 18. Unbelievable.
Well, look, you're full of energy at 28.
Oh, thank you. You're so kind. So people can reach me on my Instagram is Tracy Piper Health. It used to be the Piper Center, but I got hacked. So you can go there still to look at all my old videos. Lots and lots of content on there. But right. For new information, it's Tracy Piper Health. My website is The Piper Center. And you can call me at 212-925-0203. Or you can actually text me at 917-902-4594. And I make juices. I make sea moss. I will talk with you, do a consult, and help you through your internal fitness journey.
Beautiful. And don't forget about the Piper Protocol.
Oh, of course not. My lovely book, which yes, Nico is like, yeah.
So let me share this with you before you leave. So here are some of the comments. Thank you, Tracy and Dr. K. Thank you, Tracy, for explaining wellness with such ease and clarity. You inspire us all. Wonderful show. You are amazing. Loved your presentation. You are so gifted. Thank you for bringing me back to what is important for healthy living.
Wow.
Thank you, Tracy, for being such a rock star. Very informative show. Thanks, Tracy. Learned some new things tonight. Internal genetics, wellness, and wealth. Getting back to our roots is important. Grandma always gave us a warm cleanse quarterly. We need to go back to our roots. Balance is important. Tracy is the true light. And I will end with that. I so agree. Oh. Thank you so much for your time tonight. Everybody, this is Dr. Michael K. with the Center Pump Shop. Got a chance to speak with Tracy Piper tonight. Get our book, The Piper Protocol, and we will speak to you soon. Tracy, hang out for 1 second. We're going to end the broadcast.
Okay. Thank you guys for tuning in. I really appreciate it.